Thank you, George. Can you all hear me? Is that good? Okay, perfect. I have to make sure to get both mics. But I'm Vanessa Simpson. I'm a clinical social worker. I work for Children's Health in Dallas in our behavioral health department. And as of this school year, we have partnered with John Paul to provide a telebehavioral health counseling program to your students. So we offer this program in a variety of school districts. I work for you all and also Prosper ISD and Denison ISD. We have other care managers who are a part of McKinney and Frisco and Plano and a bunch of school districts. I feel like we're growing. Every week I hear of a new school district that we have a contract with. So it's really exciting to be here tonight to talk to you all about a really important topic, especially during your Solidarity Week. It is the perfect time, I think, to talk about this. Little disclaimer, I'm 7 months pregnant and I'm in the awkward out of breath stage. So if you hear me out of breath, that's why, but I'll do my best to talk through this presentation. But I will tell you a little bit more about our program later on and talk about some other counseling resources as well. But I want to give you guys a little bit of information about stress and anxiety and what you can do to help your students if they're experiencing that. So what we'll talk about tonight is just understanding the difference between typical stress and anxiety. Also some common symptoms of anxiety as well I want to talk to you all about, and then helping you guys and equipping you all with some tools, what you can do to help your students. I had a video on here to play, but it's a little bit tricky and we couldn't get it to pull up, but I'll talk about the content of the video on the next slide. But it is kind of interesting. We're all equipped with a fight, flight, or freeze response whenever we deal with stress, and it's all a part of the hormones that we experience as a result of feeling stress as well. So this video just does a cool job of explaining that. It's on YouTube. If you look up fight, flight, freeze, you can find it. But basically the content of the video is talking about how some stress can be beneficial to us. So stress is typical, it's normal. We all experience stress. And it can serve a protective function. So way back when, the initial function of stress was to help us to run away from big stressors like lions and bears and things that could attack us, right? And so stress can definitely serve a protective function even today as well. It's a part of that vital warning system that we all have. That's the fight, flight, or freeze response. And stress today can really help us to become more motivated. It can help us to accomplish our goals, gives us that little push in the right direction that we sometimes need. It kind of alerts us to, oh, okay, I need to act. I need to respond to this specific stressor, and that can cause some internal motivation as well. It can also help to increase efficiency too. So the key hormones that are a part of our stress response system are epinephrine, norepinephrine, and cortisol. And so sometimes when we have those elevated hormone levels, that can actually be a benefit to our immune system as well. So I know sometimes when we hear the word stress, that increases our own stress, and we get a little bit worried when we hear our students or our children talk about stress. But I do want to encourage you that some stress is actually beneficial. It's very normal. It's very typical, especially at a high achieving school like JP2. Some stress can definitely be helpful. But there's a continuum with stress, right? Just like all certain things in mental health, we have a continuum where we have the typical levels and we move toward the abnormal levels. So when stress is positive, that is when you have kind of a brief increase in your heart rate or maybe no physical symptoms at all. It's very, very manageable. It usually subsides whenever that particular stressor goes away too. So you'll have a mild increase in those hormone levels where you get that immune beneficial response, and it's positive. You're in a good place, and it's very, very manageable. So as we move down the continuum, we get to tolerable. So that's still okay. We all kind of deal with a tolerable level of stress now and then too. I'm sure most of you felt like I did, having a tolerable level of stress driving in here tonight. We had the rain, we had traffic, and so we probably had a little bit higher levels of stress dealing with that. Or sometimes you can have that level when you have maybe like a doctor's appointment that you're feeling nervous about or something specific. You've got a tolerable level of stress where It's kind of serious, right? But it's temporary. You've got a little bit of those elevated hormone levels still. Maybe they're a little bit higher than the positive level, but it's buffered by supportive relationships and also coping skills, right? So I drove in. It was kind of stressful dealing with the rain and the traffic, but I told myself that I needed to be here. I was excited to be here. So we got here, right? I managed that stress. But then when you continue on into the toxic level of stress that you see, that is where you have consistent, prolonged activation of those stress hormones that we talked about. So you're at a constant high state of stress. This is moving into the anxiety level as well. So constantly elevated hormones, constant levels of stress. We don't have those positive relationships or positive coping skills to help manage it, and it is pretty consistent. So that's why we move to the toxic level, because we're not managing it well. It's very, very constant, and we don't have those coping skills to help deal with that. So as we move into the continuum of toxicity, that's where we start talking more about anxiety levels versus regular, typical stress levels. And so what's the main difference between stress and anxiety? So like we talked about, stress is something tangible. It's usually related to a specific real event. So public speaking, doctor's appointment, driving, flying, heights, those are really common fears that can really increase that stress level. But with typical stress, it goes away when that stressor is removed from your environment. Usually you don't have many physical symptoms associated with stress either, except for that little elevation in your heart rate. And then again, it ends when the stressor is over. And you can usually, when you're dealing with stress, you can control your thoughts. Versus anxiety tends to be very, very irrational. It's not necessarily related to a specific stressor or event. It usually has at least one, if not multiple physical components, which I'll talk about on the next slide. It seems to be ever present, rarely going away. So a lot of times when I talk with students who have anxiety, they say it's just constant. It's a part of them. It's something that they feel all the time. And a big part of anxiety is that it's really, really hard to control some of your negative, anxious thoughts. So that's a big part of anxiety, is having racing negative thoughts that are really difficult to control. They're overwhelming. And that's a big indicator of dealing with anxiety versus dealing with typical stress. Anxiety is one of the most common mental health diagnoses as well. It affects 28% of the total population, so that's children and adults. So it's really important to understand some of the signs and symptoms of anxiety, because it affects a lot of people. And so some of the physical signs of anxiety that you could be experiencing, your heart could be racing. So like with typical stress, you have just a little uptake in your heart rate, but anxiety, your heart is pounding, especially if you're moving toward having a panic attack. That can actually feel like a heart attack to a lot of some people with how fast your heart is racing. You can have shortness of breath, sweaty palms, or even tingly palms, I've heard, is a symptom. You can get hives, kind of like a full body rash, dealing with kind of the heat that comes with dealing with anxiety. You can have a shaky voice, shaky hands, shaky feet, just shaky extremities. You could also have a stomach ache, especially in younger children, since they don't really know how to vocalize, I'm feeling worried, I'm feeling anxious. A lot of times you'll hear, well, I have a tummy ache, I don't want to go to school. And so that can definitely be a physical sign of anxiety. And even as you get older, just kind of dealing with like the butterflies in your stomach, that's a big sign of anxiety as well. You can feel lightheaded, and then you can also have this feeling of being detached from yourself. So almost like you're looking down at yourself, wondering, why am I feeling this way? I don't really feel like I'm part of my body anymore. So you'll notice that a lot of those physical signs are pretty serious, and they can be really scary for young people to deal with as well. So it's important, if you notice a couple of those physical symptoms, to really be asking some questions about feeling nervous, feeling worried, feeling anxious, because they could go hand in hand with anxiety. There are a handful of anxiety diagnoses in our DSM, which is our Diagnostic and Statistical Manual of Mental Disorders. That's what we clinicians use to diagnose these mental health disorders. I'm not going to go over all of them. I just want to point out that there is a wide variety of different diagnoses underneath the umbrella of anxiety. On the left-hand side, generalized anxiety disorder, that's the most commonly diagnosed anxiety disorder. And it's kind of exactly how it sounds. It's very generalized. There's not one specific thing that's causing the anxiety, like maybe social anxiety disorder or specific phobia. That's a little bit more specific. But with generalized anxiety disorder, you have an excessive amount of worry more days than not. It's really, really challenging to control that worry, specifically when you're dealing with some of those anxious, negative thoughts like we talked about before. And then you have one or more of the following symptoms. So you could be really restless. We see that a lot in our youth, is that restlessness, being easily fatigued as well, and having poor concentration. I see that a lot with our youth too. It's just really, really hard to focus in school and in class because you're dealing with all these negative racing thoughts. And so the key thing to point out with all of these anxiety diagnoses is they have to be causing extreme impairment. So in school, at home, in your job, and it has to be for more than 6 months. So that's kind of the key with anxiety and also a lot of mental health disorders is it has to cause that extreme impairment. So it has to be really impacting your ability to go to school or learn in school or be with your family at home or do well in your job if you're a working adult. And so we talked a lot about anxiety, what it looks like, how it's different from stress, and you're probably wondering, what can I do to help if my student is dealing with that? So the good news is there's a lot of preventative measures that you as parents and as family members can take to kind of help your students overall with their mental health, so not just with anxiety. But 3 big routine things that are important for children are healthy sleep hygiene, healthy eating, and an exercise routine. So just establishing healthy routines overall can be really, really impactful for the mental health of our kids. So we want to make sure that they're eating really healthy, nutritious foods. We want to make sure that they're getting enough good sleep at night, which I know can be hard with the amount of homework that they have. And then also just having some type of exercise. So whether they're involved in a sport and they're getting exercise that way, or maybe you all just take a family walk around the block every night. It doesn't have to be rigorous. It doesn't have to be intense. You don't have to join a gym and have a membership or anything like that. But just some type of exercise on a routine basis can be really, really impactful for the mental health of our kids and for us as adults too. And then really importantly, we want to help manage our youth's screen time. I know that they all have phones. They're always on their phones. They need to use their laptops and their computers and sometimes even their phones for homework. So it's inevitable that they're going to be spending some time on their screens, but making sure that we're keeping track of social media, keeping track of the news that they look at, just kind of keeping and monitoring their access to certain things like that can be really helpful for their mental health. Making sure that they're only using screens as much as they need to. They're not on it all the time in their free time. That's really, really important. And I know it's easier said than done, but it's definitely impactful for their overall mental health. And then I can't emphasize enough just having open communication with your youth. They really value, I know it doesn't seem like it as teenagers, but they do really value their parents and their family members, and they care what you think even if they're not going to say it. And so if they're struggling with feeling stressed or feeling anxious, but they feel like they can't come to you and talk with you, that can be really hurtful to them and that can be really impactful. So just keeping the lines of communication open, checking in with them, normalizing, which I'll talk about on the next slide, but just really making sure that your students know that they can come to you if they are struggling with their mental health. That's really, really big. And then a way to do that is to incorporate family time into your weekly routine. So maybe having family dinners every night or once a week, if that's what you can do as a family, or having some type of engagement. So maybe you have a board game night, maybe you go to the movies as a family, maybe you pick a night and you all go out to eat once a month, whatever that is, but making it kind of a routine where your student can know, okay, I know I'm going to be spending time with my family on this day. We're going to do this. We always do this together on Thursdays. Having that routine with that family time is really, really big because that opens the lines of communication for them. And they know that they'll have access to you at that specific time. So those are all really helpful preventative measures that you can take just to kind of create that environment of safety at home, and creating those lines of communication. There are a handful of behaviors that you as family members can model to your students as well. So really big is just normalizing and validating their concerns. So, if your student comes to you and they talk about how stressed they're feeling with school, they have so much schoolwork, JP2 is a hard school, they have a lot of things that they have to do, and just validating that versus saying something like, well, you don't know what stress is. Because as adults, we know that we experience a different level of stress, right? So it can be easy to minimize the stressors of a teenager, but that's super valid to them in that moment. And if we can take a step back and think about what it was like for us as teenagers, we know that that was a hard time too. And so if we can normalize and validate their feelings, that's really, really big. And then too, just remaining calm. I have a lot of students that I work with tell me that they feel like they can't talk with their parents because they don't want to upset them. They don't want them to get angry. They don't want to hurt them if they tell them about their mental health. And so if we can just remain calm when our students come to us and say, you know what, I'm feeling this way, I'm feeling really stressed, I'm feeling really down, and we don't come back with our own stress and our own feelings, that can be really helpful, again, to open those lines of communication and help them to feel like they can come to you. They feel like it's a safe place. You're not going to explode on them. You're not going to get upset. So just modeling that calm behavior can really help them to remain calm as well. It's also important not to tell them what to do or how to feel, because that just really doesn't validate the way that they're feeling. It discredits their own feelings. It discredits what they're going through. So it's really important to just take some deep breaths, kind of go with the flow, remain calm, like I talked about before, and that opens, again, the lines of communication. And so we also, in opening the lines of communication, we don't want to shame our students for the way that they're feeling. Everyone has a right to feel the way that they feel, right? And so if our students are feeling stressed or they're feeling really anxious, that's okay. We can help them. I'll talk about things that you guys can do as parents to help them and also what professionals can do. But we definitely don't want to inflict any shame or guilt in the way that they're feeling, because a lot of times they really can't help it. And so if you model those behaviors to your students, that'll help them, again, to want to talk with you, to want to come to you, to want to open up about their feelings, so that you can in turn provide some support and provide some assistance. And these are some things that you guys can do. So one thing that's really, really helpful when you're dealing with someone who is stressed or being really, really anxious or worried is deep breathing. When we feel stressed and those hormones are creeping up and they're getting more and more intense, our breathing can become shallow, more rapid, and quicker. And so the way to slow it down is to help your body with deep breathing. And so what that looks like is you inhale for 4 counts, hold for 2, exhale for 5. So the key with deep breathing is that exhale count just needs to be 1 more than what your inhale count is. And what that does is that helps to regulate your body, helps to regulate those hormones that are on overdrive, and that helps to kind of clear up your mind, and also just to kind of slow everything down. So deep breathing is really helpful when you're dealing with stress and anxiety. Another thing that you can do is called guided imagery. And so what you can do is whenever your student's feeling stressed, you can tell them, okay, I want you to imagine being in your favorite place. So somewhere that you feel really relaxed. That could be at the beach, that could be at grandma's house baking cookies, that could be at home in their room. But if they're feeling really stressed, just having them imagine their favorite place to be, or even their favorite things or their favorite people, just kind of imagining that can also help to bring everything down that's on overdrive in their body and just help to give them a sense of calm in that moment. Another really helpful thing to do is to list things off alphabetically. So what that does is that engages a different part of your brain versus the amygdala that's on overdrive when you're feeling stressed. And so listing things off helps to quiet that amygdala down and give room for the other parts of your brain to kind of take over. So they could list off songs, they could list off animals, anything, whatever your student is interested in, they could list off alphabetically, and that can kind of help to slow everything down and regulate everything when it's on overdrive when they're feeling stressed. Two things, if they're able to have something physically, you could just use a good old stress ball, or like a fidget spinner or fidget item. Those have been really helpful for some students, just depending on what's going to be helpful for them. And also glitter jars. Those are great for the younger kids because you can make a jar and it has glitter in it and you kind of turn it over, all the glitter is everywhere, and you kind of help guide them with either deep breathing or another exercise until the glitter settles, and that kind of signifies that they're getting to a place where they're feeling settled as well. So for the younger kids, that's kind of fun. And then a really helpful technique for in the moment when you're feeling really stressed and on overdrive is called grounding. So it's 5, 4, 3, 2, 1. So you name 5 objects that you can see, 4 that you can touch, 3 you can hear, 2 you can smell, 1 you can taste. So you think about the 5 senses and you kind of go down the list, and that just helps to bring you back to the present moment. You realize that you're here in the present. Those are all sensory things that are around you. We're not worrying too much about the future. We're not focusing on the past. We're right here in the present. So that's really helpful too if you're working with a student who has trauma and maybe they're kind of feeling stressed and anxious about the incident that happened. Grounding techniques can be helpful to just bring you back to the present. And that's worked with a lot of students that I've talked to as well. And then 2, just kind of preventative coping skills that you can utilize before you get to that really stressful and overwhelmed place. You can write, you can journal, you can make music, you can listen to music, and also exercise as well. So those are kind of things that you would do preventatively versus in the moment when you're feeling stressed, just to kind of help balance out your overall anxiety and your stress. So those are some things as parents that you guys have at your disposal to use with your students. But what if you try those things? What if you feel like more help is needed than what you're able to do as parents? What if you feel like it's just out of your control? There are a couple things that as therapists we use and we're able to use with students that are really helpful when working with anxiety. And the biggest therapeutic intervention that I utilize is called CBT, cognitive behavioral therapy. And so, like I mentioned before, when we're dealing with anxiety, a lot of times we're dealing with racing negative thoughts that are overwhelming and we feel like we can't control them. So the premise of CBT is that our thoughts affect our feelings, which then affects our behaviors. And so if we're able to really focus on and tackle those thoughts that we're having, that has a really big impact on the way that we feel overall, and then also on the way that we behave. So a lot of times what I'll do is I'll have students kind of keep track of their thoughts, and that brings awareness to the type of thoughts that they're having. They're usually negative. They're usually along the lines of, what if this happens? What if this happens? Or I can't do this, or I'm not good enough, things like that, which are very negative in nature. And so imagine that that's all you're thinking on overdrive all the time. You're not going to feel very good, right? And so if we're able to stop those thoughts, challenge those thoughts, and change those thoughts, then we're able to affect the way that our students feel as well. So CBT does exactly that, and that's what I use a lot with students to help with their anxious feelings. Another therapeutic intervention that I utilize is called mindfulness. So when I was talking about the grounding technique, that's kind of rooted in this mindfulness intervention as well. It's learning to be present in the moment that you're in at that time versus focusing too much on the future or those what if type thoughts, or focusing too much on something that happened in the past that you're kind of going over and over again in your head. So it's a collaboration between your mind and your body, and it kind of helps to stay in that moment when you focus on what's going on in your body. So when you're focusing on your breathing, when you're focusing on some of those physical symptoms that you have with anxiety and kind of counteracting those. So a big part of mindfulness is that grounding that I talked about, and also deep breathing as well to kind of help regulate your body so that you can focus on the present. And you kind of learn to build mindfulness into different moments in your everyday life. Yes. Oh, thank you. Appreciate it. And so with mindfulness, you're building it into everyday moments in your life. So what I'll talk with students about is just incorporating deep breathing into different parts of their day. So it could be when they first wake up in the morning, when they go to bed at night, if it's before a specific class where they know that they're going to be feeling anxious, just kind of focusing on that deep breathing to free up some of that space in their mind where that anxiety was previously taking over. And so mindfulness takes a lot of practice. Definitely isn't something that gets solved or accomplished in the first session or the first couple sessions. It takes a lot of practice. And then same with CBT, you have to retrain your brain to be thinking this way versus thinking in that anxious way. But that's where therapy and counseling can be really beneficial for someone who is experiencing a lot of anxiety. And so if that is something that you feel like would be helpful for your student, I definitely want to talk to you about a couple different options. So we do have our telebehavioral health program that I mentioned at the beginning of the presentation. So all of that goes through your wonderful school counselors here at JP2, but we offer virtual therapy sessions for your students. So I'm not physically on campus with the students. We use an iPad that's set up in the counselor's office, and we meet for 30 minutes once a week. And this is short-term therapy as well. And so sometimes what happens is we engage in the short-term therapy, but we know that maybe longer-term therapy would be more beneficial for your student. This is a good option because sometimes it can be, it can take a while to get connected with a counselor in the community. And so this can kind of bridge that gap, which is really beneficial. It also eliminates barriers like taking off work, your child missing school. So I'm really excited that we have this here for your students at JP2. Some other great resources, LifePath of Collin County. They offer free or very reduced cost counseling sessions, and also psychiatric visits as well. So if medication is something that is on your mind or something that you think could be helpful, LifePath is a really great resource. They serve all of Collin County. And then talking with your child's pediatrician for a referral is another really wonderful place to start. They have insurance information, they have lists in their office, and then calling your insurance directly as well. You can find a list of covered counseling providers by zip code. There's always a number on the back of your insurance card. That's another great place to start because then you know that you're getting providers who are in network, so you don't have to worry about that. And then there are some really helpful websites as well. Psychology Today has a list of therapists. You can search by subject, you can search by zip code, you can search female, male. Psychology Today is a really wonderful resource, as well as some of these other websites that I have up there for you all as well. And that's all I have for you all tonight, but I appreciate your time and I would love to answer any questions that you might have.